The province says early signs are encouraging, but the brutal influenza season is finally letting up, though the work is far from done. 16 of Alberta's largest hospitals are currently over capacity, and doctors say they still need a lifeline. Tim Brooke has more on what's being done to help.
Another day, another upset emergency room visitor.
You might ask for us to see a doctor, but you might not get to see him for 10 to 12 hours.
Douglas Gauld, fresh out of the hospital, tells us the waits are painful and he knows of a fix.
Physicians, more nurses, better structure in the government.
The latter point was partially addressed on Thursday. For the first time since a 44-year-old man died after waiting for more than 8 hours in an Edmonton emergency room, Alberta's Minister of Hospital and Surgical Services took questions from the media. His message: assistance is coming, but it won't be in the form of a state of emergency.
We have all tools and authority necessary to manage the system.
As the flu season slowly lets up, a new physician position will be created to help triage. The focus in the days ahead will be on accelerated discharges and on spreading out patients to facilities that can handle the load.
There is province-wide coordination. There always has been, there always will be. And I would say that it's the only reason we've gotten through the bulk of respiratory virus season.
Many health workers have a different version of events. It's one where the province was warned but failed to properly plan for a bad influenza season, and one where the measures announced Thursday are only reactionary.
There's, maybe a lack of knowing who the decision makers are, and that's just at a time when a system is under stress, that's just an added pressure that's not needed.
This isn't just a flu season problem. Right now we're seeing a lot of stalling, delaying, and promises that years from now there will be more acute care hospital beds.
Backed by one of Alberta's largest unions, doctors are still calling for a state of emergency. Matt Jones believes the province is capable of coordinating without.
We can, of course, do better, and we will learn and do better. But I think the teams from the hospitals all the way up to the agencies and even my department officials have done fantastic work.
Tim joins us now with more. Tim, the minister had another announcement today.
Yes, Tara, the province has ordered a fatality inquiry into the emergency room death of that man in Edmonton over the holidays. The goal there is to learn a little bit more about the circumstances that led to the death, and maybe even, Tara, the reports will include some recommendations to ensure that something similar doesn't happen again.
Okay, Tim, thank you.